What should my COMLEX Level 3 study schedule look like? Imagine walking into the exam room confident, knowing your study plan has you covered from every angle. That's what a good study schedule can do for you. When preparing for the comprehensive osteopathic medical licensing examination Level 3, a clear plan makes all the difference. This exam is a 2-day test with about 420 multiple-choice questions on day 1 and 26 clinical decision-making cases on day 2. Understanding this structure helps you focus your study efforts. Most candidates spend between 3 to 6 months preparing, depending on their clinical duties and personal time. On average, dedicating around 15 to 20 hours weekly works well. Break this down into manageable chunks to avoid burnout. Start by building a solid foundation. Spend roughly 40% of your time reviewing core clinical topics like internal medicine, family medicine, surgery, pediatrics, obstetrics and gynecology, psychiatry, and preventive medicine. Use high-yield resources and do practice questions to find your weak spots early. Next, move into application and integration. Allocate about 45% of your study time to practicing questions and clinical case simulations. This helps you connect concepts across disciplines and sharpens your clinical decision-making skills. The remaining 15% should go toward final review. Focus on full-length practice exams under timed conditions. Review your weak areas and keep your mind and body healthy. A typical weekly schedule might look like this. Monday, 5 hours reviewing internal medicine. Tuesday, 4 hours practicing family medicine questions. Wednesday, 5 hours on surgery topics. Thursday, 4 hours covering pediatrics and obstetrics. Friday, 5 hours on psychiatry. Saturday, 4 hours doing timed practice exams. And Sunday, 3 hours for light review or rest. Adjust this plan based on your strengths and schedule. If residency limits your daily study time, aim for 10 to 20 questions daily and longer sessions on days off. Starting early in your intern year is smart because testing centers often book months in advance. Planning your exam during a lighter rotation or after a short break can give you extra focus. Incorporate osteopathic principles into your study routine since COMLEX emphasizes these alongside clinical knowledge. Use question banks like UWorld tailored for COMLEX Level 3 and practice clinical decision-making cases to get comfortable with the exam format. Consistency is key. Gradually increase your study hours as the exam approaches, aiming for up to 8 to 10 hours daily in the final weeks if possible. This balanced, phased approach helps you stay on track without feeling overwhelmed. Remember, a well-organized schedule tailored to your needs can make your study time more effective and less stressful. Keep your goals clear, stay consistent, and you'll be ready to succeed on exam day.